Welcome, everyone. You have to realize this is about exercise as medicine, and you're doing the opposite of what we want you to do. So the first rule of this session is that anyone who'd like to stand up and wiggle around, this is a place where you can have twitching, fidgeting, anything, and we will periodically remind you that you really should get up and move. So our panel today, we're going to start out with a little bit of information about why we think, and we know, actually we don't even just think, we know exercise is very powerful medicine. And then we will have some of our panelists also talk about how they apply exercise as medicine into their daily life. So we'll be talking about actually two in the clinical setting, as well as our actually, I want to make sure I point out it's Dr. Rosenberg. She's just defended her dissertation. She's actually going to talk how she applies exercise as medicine to her two children who have supported her through this process. So what is exercise is medicine? Well, when you think about your health, I'd like to point out that 50% of your health is determined by things that you can do. That are quite powerful. So we're going to be talking about the first, which is physical activity. The second is healthy diet, and we care about that as well, but we're not going to talk about this today. And the third is not smoking, which we will talk a little bit about today. So I always like to start by saying this quote, which comes from Dr. Robert Butler, who was the founder of the National Institutes on Aging. So if exercise could be packaged into a pill, it would be the most widely prescribed medicine in the nation. And, you know, we actually know that exercise is as effective, if not more effective, than many of the common medicines that people take for a number of health conditions. I like to show this as the TC gym many years ago. So we've known a long time here at TC why exercise is important in physical activity, and we have a lot of evidence about this. So we have epidemiologic evidence from populations, we have lots of randomized clinical trials, and also some meta-analyses of multiple studies. So let me just tell you a few of the things that exercise can do for you. So first, we know it can improve your fitness. So it improves your aerobic fitness and your muscular fitness. It helps you to have a healthier body composition and body weight. It improves your bones. It improves your functional health, meaning that you can get around and about and do your activities of daily living. And, you know, to follow with Goldie Hawn's talk about mindfulness, it improves cognitive function and attention, because exercise also is mindfulness. And as far as health, it is one of the most powerful things you can do for your personal health. It reduces the risk of dying. It reduces the risk of you developing heart disease, high blood pressure, stroke, metabolic syndrome, type 2 diabetes, breast cancer, colon cancer, depression and anxiety, Alzheimer's disease, and falling. So I imagine probably everyone in this room, if I asked you, you'd raise your hand because you'd like to avoid having probably multiple things on this list. Right. So this actually shows, you know, that you could be healthier. What's more funny is my joke, but you can't see it very well, so I'll tell you. So this is a doctor talking to the patient, and the doctor says, what fits better in your daily schedule? Exercising for an hour a day or being dead for 24 hours? That's how important it is. But what I'd like to show you is that exercise can reduce your mortality. So even getting an hour of exercise per week, you can reduce your risk of dying by at least 20%, if not more. So the other thing is every minute of exercise that you do, so just 1 minute of exercise, will increase your life by 7 minutes. Now, it doesn't sound very much, but just think if you only spend a few minutes, even every week, that's quite a lot of time. And I'll show you later that it'll also improve how functional you are, so it's even better. So exercise reduces your risk of heart disease by about 30 to 40%. So heart disease and other strokes. It reduces your risk of colon cancer by 24%. It reduces your risk of breast cancer by about the same, 20 to 30%. Pretty powerful. We don't have medicines that are that effective. And then, if you are active, so I already told you you live longer if you're more active, but most important is that you'll live and be more functional. So this shows sort of your life, and all of us, we're unfortunately or fortunately, we get older and we start to be at decline and start to be unable to do as much. So this will happen to all of us. But the most important point is the fact that as we start to decline, we start to be unable to do our activities that we enjoy doing, or just our general activities that are important for health. But if you stay active, you're going to be able to maintain your function much longer. And I just always have to tell everyone that sitting's killing you. So what you're doing right now isn't that killing you. And what this studies have shown is that even if you exercise, but you spend a lot of your time sitting at your desk or at your computer or interacting with your technology, your risk of dying actually increases with the amount of time you spend. And it's a little hard to see here, but what I would show you is over here. These are the most active people. So this is your risk of dying. So you do have a very low risk, although eventually all of us will die, even if you do exercise. But what I'd like to show you is here. This is somebody who is active. They get 7 or more hours a week. So that's a lot of exercise. But they sit for 7 or more hours per week. Their risk of dying is actually increased in a way that's very similar to somebody over here who doesn't exercise. So it's about 50% greater increase. So what can you do about this? Well, what you can do, it's very simple. It's not too stressful. So, you can reduce TV time or computer time, which is pretty hard for most of us to do. But what you can do is get up out of your chair regularly. So at least a minute or two every hour. Just getting up, you can move around or just stand. That's going to reduce those health risks that come along with sedentary time. So in case you're feeling like you should get up right now, you can feel free to do that. So, and the other thing I just wanted to quickly mention, because you're probably going, well, what should I do? There's a lot of things. There's a whole menu of types of exercise you can do, because a lot of people actually think of exercise and they think, I'd rather have my teeth drilled than exercise. That's probably not the group of people here because you came here to this session. But there's a lot of things you can choose. So you can pick aerobic activity, you can pick weight training, you can do stretching exercises, and you can do what we call neuromotor or functional exercises. So those are things like yoga and Pilates, but it also includes exercises where you're balancing and you practice your agility. And the fact is that we know that all of these types of exercise can improve your health in some way. So the most evidence we have is about aerobic exercise and resistance exercise. But the idea is that you can pick and choose, and you can mix and match. And all of those, most important thing is that you're moving. So I just want to introduce the subject, but I did want to direct you, if you have a lot of interest in improving your exercise, that we have some great resources. In 2008, the United States released its first physical activity guidelines, and that you can actually get lots of information here through the U.S. government. You just look for physical activity guidelines, and there's tips for kids, adults, older people, and that'll give you a lot of detail about what you can do.
So now I'd like to talk about something that's much worse than sitting. And my research focuses on things that are much worse for you than just sitting there. What I have up here is what I call the chain of chronic disease. And so that was a nice overview by Dr. Garber. Thank you. And I'm going to get into a little bit more specifics about my research and the things that I focus on and how exercise can help break this chain of chronic disease. So the key thing would be to not smoke. As she mentioned, smoking is by far one of the worst things that you can do for your health. We know it's related to all types of cancer. It has a negative impact on every organ in your body. Those who smoke clearly die earlier than those that don't. The thing is that often with smokers is that we have comorbid things like mental illness or other drug use like alcohol, excessive alcohol use, and those things are very much related. And so you have an individual who smokes or they drink too much, and they may also have mental illness, which then leads to other issues like not participating in exercise or doing other behaviors that might put them at risk for various different things, HIV, for example. And so these things are all related, and you have excessive alcohol use, smoking, mental illness, physical inactivity, poor diet, and then other illnesses that might be part of that as well. And so it is just this chain of chronic disease individuals that present to us with various different issues. In some way, they often can be linked back to one of these things as part of the chain. And so my research focuses on these key things right here, which is smoking, physical inactivity, mental illness, and excessive alcohol use or other drug use. And so what I try to do is to intervene with individuals who are trying to stop smoking or trying to use drugs. And as I said, oftentimes those individuals have mental illness, and so it's a matter of also treating mental illness with exercise. And so if we can do that, then it's something that we can help prevent this chain of disease, go forward and reduce somebody's life or reduce their quality of life. And so my key study that I have right now that I'm looking at is called Strength to Quit, and it uses weight training. I'm not a big aerobic person. I don't particularly like to run very much, or at all actually. And so I would much rather lift weights, and so that's what I pursued as my area of interest and research, and this study is using weight training as a method to help individuals quit smoking. The thing about it is that, as I said, individuals who smoke often do other things, and so the typical person in my study may have diabetes, type 2 diabetes. They often have mental illness such as bipolar disorder or a clinical or subclinical level of anxiety or depression. They often will have hepatitis, or they'll have a previous crack or cocaine addiction. And so those individuals, they seem to be able to kick their other habits. They maybe have been able to stop drinking. They may have been able to stop using crack, but they can't stop smoking. And there are lots of issues that I could go into about why that I think is the case. We don't have time for that today. Nonetheless, this study is funded by the National Institutes of Health, by the National Heart, Lung, and Blood Institute. It was a $2 million study. It's a 5-year clinical trial. It's ongoing, and we currently need participants. So, if you know anybody who wants to quit smoking, just please visit strengthtoquit.com. And all the information that you need is on that website. And give us a call. We'll see if you're eligible, hopefully, or whoever you may know. You may say, well, how could exercise help somebody quit smoking? How does that actually work? Well, this is the biobehavioral mechanism of action that I've developed. And so if you have on the way on the other side over there where it says quit attempt, right? Now this can be for whether it's for smoking or drinking or other drug use, is that the individual will experience some withdrawal, and that withdrawal is that it could be cravings to use the drug, that they'll have sleep disturbance, that they'll have what is called negative affect, or a negative mood. They'd be grumpy or grouchy or irritated or angry. And as well as they would often gain body fat. This is that there's cravings to use and the individual is trying not to use, and so oftentimes food is a nice substitute. Individuals who try to quit smoking often crave sweets, and so then they directly go for high sugar foods, which can increase calories pretty easy, and so individuals end up gaining body fat. So if we can get these people to exercise, then we can do things like reduce their withdrawal symptoms, reduce their negative mood states. We can increase their sleep quality. We also can change their physiological profile, so they have better physical fitness with psychological and physical. Their metabolic profile is better. They're able to use sources more accurately with their bodies. It's a matter of using the right fuel source for when they need to operate. And this can result in decreased body fat. And so that can reduce the disease risk, and as well as the drug use, the relapse that could possibly happen. And so that's how I visualize that this happens. And so, again, coming back to this chain of chronic disease, if you can change this physical inactivity to activity, then you can bust open this chain and hopefully prevent and reduce disease and increase quality of life. That's it. Thanks.
Might be a nice time for those that want to take a quick stretch, stand a little bit, and avoid that sitting time. Very dangerous. So while everyone's stretching. So my goal for my overview here is to try to convince you that not only is exercise good medicine, but exercise is good medicine specifically for your arteries. So my area of research interest is trying to prevent vascular aging. So 2 things I want you to take away from my talk today. 1, we are only as old as our arteries. And 2, exercise is very good medicine for our arteries. So this is a study I always like to teach my students about. And when I worked in a hospital, I always kept this paper in my back pocket, because I would talk to physicians and they would be very keen on medication, medication, medication. This was a study done in Germany, and I think it'd be tricky to do here in the US because of ethics, and you'll see why in a second. But Dr. Rainer Hombrecht took a group of about 100 patients that came in with a heart attack. 50 of these patients got the traditional treatment. So they had a stent put in to fix the clogged artery. 50 people walked away without that treatment and were prescribed exercise. And so, yeah, it might be a little tricky to do that here in the US. The results, though, were astonishing. The results actually showed that those that exercised did way better than those that got the stent. The stent fixed the little problem in the heart. Exercise fixed all the problems, not only in the heart, but all the vessels throughout the body. So survival was better in those that got the exercise prescription. And just some numbers down here, obviously it was a little less expensive for the exercise versus the surgical treatment as well. So I always tell students, keep this handy. This is your proof that exercise is a very powerful medicine. When you put it head-to-head against the drug, it wins in this case. In this case, it won against surgery. Now, this slide didn't show up too well, but the area of research that we're interested in is we're trying to figure out, believe it or not, of all the risk factors that we know about heart disease, that doesn't fully explain a person's risk. So things like blood pressure, like glucose, like smoking, that only explains about 50 to 60% of your risk for actually having a heart attack. So there's still this mystery down here called residual risk. that leftover risk, what actually contributes above and beyond to heart attack and stroke? And we feel that the answer is in our arteries, that it has to do not only with delivering blood throughout the body, but how elastic your arteries are. So whether we like it or not, our arteries lose elasticity as we get older. It's inevitable. But we can slow that progression. So I always like this cartoon here. My bones are getting softer, but my arteries are getting harder, so it balances out. But we are only as old as our arteries. And just to kind of give an overview of why we care about this is my cheesy animation over here. Heart's all the way down there. Each time our heart beats, our arteries are very elastic. They're actually going to expand and cushion blood and move it throughout the body so it's nice and smooth. As we lose that elasticity, what we have here in the cheesy animation, we have these pulses of blood shooting through the body. And this can actually damage all the organs throughout the body. And I'm going to skip ahead a few slides, but I'd like you to actually check your own arteries right now. So there's a way that you can do this to see how elastic your arteries are. What I'd like you to do is try to find your pulse on your right hand here, right on the wrist. So you're going to go right down your thumb to the radial artery. Now, with the other side, try to find the pulse in your neck. So this is going to be a little tricky. You might have to change how you find that pulse on your wrist. So you're trying to get the pulse on your wrist and on your neck at the same time. I'll give you a second to try to find that. Anyone get both?
Yes.
I see some head. What do you notice about the pulses? Are yours occurring at the same time? So hopefully what you should feel is that you'll feel a little difference in that in the pulse. You should feel one before the other. If they're occurring very close in time, that means actually your arteries are getting a little stiff. But you should actually feel one. Don't worry, exercise is medicine. So I'm going to skip through here just to say that when we look at all of the organs in our body, so we know that stiff arteries actually damage all the organs throughout our body. And when we look at the brain, we look at the kidney, this is how a lot of us view it. But let's not forget, these are exquisitely vascular organs. So if we can improve the elasticity of the blood vessels throughout the body, this has a very favorable effect on health overall. So what our research is interested in is trying to figure out the optimal exercise dose for healthy arteries. And I want to leave you with, well, we can skip through this, with this image here, is that there is actually a spectrum of exercise for artery health. So when you're trying to figure out what's going to be best for you, obviously doing nothing is not the way to go. That will make your arteries stiffer. Walking and aerobic activity is very good for your arteries. But there's actually too much of a good thing could be bad. So we do see that individuals that run chronic marathons actually have stiffer arteries than those that do nothing at all. Individuals, I'm sorry for the smoking part of it, individuals that do very heavy weightlifting actually have stiffer arteries. So maybe the smoking and the weightlifting together.
We can talk about that later.
I'm a lifter as well, so this part of it is always hard for me to swallow. I don't personally believe it, but there's literature out there to suggest that weight training is not the best. So aerobic exercise, low intensity resistance exercise, I'm with you, is going to be the best medicine that we can prescribe. But we're still trying to figure out, so Dr. Garber already showed this one.
We love this. We love this.
This one's my favorite. But what we're trying to figure out now is, as with any medicine, there's confusion about how much, what type, and what's going to be the best. So that's what our research is trying to elucidate, is these different combinations. And then maybe trying to get people to think about this a little differently, because the word medicine is still kind of, even though exercise is medicine, we do have to try to get people thinking a little differently. And my colleague at Syracuse actually said this, that maybe we should switch to exercise is chocolate, because everybody likes chocolate. But just to sum up that aerobic exercise is going to be very good medicine for your arteries. And we know that improving that elasticity of the blood vessels is going to increase longevity. So that's going to be the way to go. Weight training, we'll talk after.
Trained both as a cardiologist, I specialize in prevention of
cardiovascular disease, and I actually run a cardiovascular disease prevention program in Lipid clinic at St. Luke's and Roosevelt Hospital just up the road. But I also trained as an exercise physiologist because I felt that cardiovascular health could be attained not only by medications and procedures and stents and things like that, but by physical activity and exercise. In fact, you know, exercise really is a perfect medicine. And why is that? Well, it doesn't have to cost anything. You know, you can go for a walk, running shoes, you know, maybe you want to have weights, which might cost a little bit more, but really overall the cost is low. There's few, if any, interactions or side effects. And you heard Dr. Garber say that it can reduce blood pressure, cholesterol, prevent diabetes. So actually, I have patients who are pre-diabetic, they're overweight, don't exercise, and by changing their lifestyle, they have prevented themselves from becoming diabetics. And I see it. And one of the really great things about what I do is I can treat patients with medicines, I can treat them with exercise and diet, and I see the results. It can strengthen the heart and cardiovascular system, the bones and muscles, to prevent falls and fractures, weight loss, as good or better than any diet. So personally, you know, I have found a way to exercise every day, and this included during my medical training when I had to be very creative. So one time I did my cardiology fellowship up at Columbia, and we'd be on call, and we really couldn't leave the hospital. So I ran circles around the hospital pre-dawn with my beeper. At another time during my residency, I ran through basement holes in the morning. Now also I should share with you when I was determining my doctoral project, Dr. Bernard Guten was my advisor, mentor, and we used to run in Riverside Park together, and we developed my project running through Riverside Park. So I feel that exercise is medicine. I cannot imagine my life without exercise. I'm very glad to be here with like-minded people. Thank you very much.
As physical activity has been important in my life as an exercise physiologist, I have a 4-year-old and an 18-month-old. My 4-year-old actually has been very interested, hyperactive, and we walk to school together. I try to incorporate it without even having her notice that I'm incorporating it. And we've started talking about the importance of physical activity and exercise, just because she kind of doesn't really know what I do. So I take her into the lab. I've taken her into her lab and had her try out the treadmill, and she loves it, so she wants to come more often. I've actually uploaded this application on my, it's called, if you're interested at all, it's a 7-minute workout. And I just was very interested in trying it out. Somebody recommended it to me, and my daughter saw me doing it. All of a sudden she started to do some push-ups, some jumping jacks, and is constantly trying to encourage me now to do it even more. In yoga, I think my 18-month-old keeps watching us and doing it. So I kind of try to incorporate it, and having her not sit all the time. Little kids can't sit anyway, so I'm kind of encouraging her, except jumping on the couch because I can break it. But that's how I pretty much encourage it, and hopefully she'll continue doing it regardless, just because she knows the importance of it. So that's how I incorporate it into my life.
Like Dr. Garber said, I'm graduating in May. It's been a wonderful experience. And so I'm a student in the Applied Exercise Physiology program, and I'm also here representing Open Door Family Medical Centers, where I work as an exercise specialist. Just a brief background, Open Door is a patient-centered medical home. We serve over 40,000 patients, and we're based out of Westchester County. Our mission is to provide quality primary health care and human services to the community, particularly to the low-income and underserved populations. So under one house, we have primary care, vision, podiatry, dental, chronic disease care management, behavioral health, nutrition. A couple of our sites have physical therapy now. We're also located in several schools throughout Westchester County where we do things like screenings and physicals for the kids. So what does this have to do with exercise? Well, if we really consider exercise as medicine, which it's from the sound of it, I think, at this point, is the case, then what better platform to apply that? And since we're for preventative medicine, what had happened is in 2011 we started our wellness program, our weekend Podemos wellness program, and so in a nutshell, what we have to offer is both for staff and patients, because we need the staff to believe in it in order to want to encourage and inspire the patients to believe in exercise, right? So if you're a patient at Open Door, what would happen is you'd go in and first of all you'd see signage on the walls encouraging you to move, for example, take the stairs instead of the elevator. Then when you're in the exam room, you'll see signage on the walls that prompt the patient to ask about their weight. Then the PCT would come in, or the patient care technician would come in and take your vital signs, your blood pressure, ask, do you drink, how often do you drink, how often do you smoke, and then they'll ask, how often do you engage in physical activity? So we have integrated this PAVS, Physical Activity Vital Sign, into our EMR, our electronic medical record system, and now that's a part of the series of questions that are asked to our patients, so we can get a baseline in terms of their physical activity level. And from there, at this point, what we have now is a customized exercise prescription. So just as you would be prescribed pharmaceuticals, you can now, the providers can prescribe exercise. And so between that, the physical activity vital sign and exercise prescription, they're able to go ahead and prescribe the exercise, as well as refer them to our wellness program, where we offer the opportunity for patients to take yoga, Tai Chi, Zumba, things like that. So how exciting is that? All right, and I think that's all I was going to say. Thank you.
So we're actually going to encourage questions, and if we have any lull in the time, we'll have Joe and Kevin have an argument about aerobic versus resistance training. So what do you want to know about exercise?
Thank you. This question, I guess, centers more about physiology and relates to smoking. Decades ago, people who smoked did it as habit. It wasn't considered unhealthy. And a lot of people still live to very old ages. The Israeli Prime Minister, Golda Meir, I remember she was known as being a heavy smoker when she was 93 or 94 when she died. And so what is it different about the physiology of a person who isn't affected by a lot of smoking? And also, if I can talk about my wimpy capacity, I've never smoked, but I just have to breathe the clothes of a smoker, and I'm wheezing literally for hours. Is there any exercise or anything I can do to strengthen my vulnerability, if that makes sense? Other than live in a bubble.
There you go.
Okay, so this is a common question that I get is that, my grandmother lived until she was 1,000 years old. She smoked every single day like a chimney, right? Just because you can point it to one individual who maybe lived a long time and smoked, yes, that's possible, certainly. There's an interaction of a lot of different things, the way that people smoke, the genetics that they have that are combined with the chemicals in the cigarettes. And then there are other behaviors. And so, for instance, exercise can offset some of the negative effects of smoking. It depends on how you look at studies. And, if you look at a very big study and you look at these epidemiological large studies that show various different effects. They often control for multiple different things, and then it's hard to determine what you're actually looking at because so many effects are controlled, and that doesn't particularly happen with the human body. Because the human body is this synergy that all works together, and the physiology is something that creates you being who you are. So it's hard to talk about individual differences. I think we can think of the big trends of major things that can impact you versus individual, some one person or group of people that are able to survive a certain thing. Does that answer your question?
Yeah, and how can we protect ourselves from the effects of outsides?
Well, I mean, outside of being a nuisance, actually, which it is, of course, right? As far as inhaling secondhand smoke, you have to be, there's studies that have been done with this, and so for somebody to have smoked the equivalent of one cigarette, you have to be surrounded and essentially engulfed by secondhand smoke for about 2 hours. So while it may seem like, especially in New York City, if there's somebody walking in front of you and they're smoking and you're breathing in all that smoke, I wouldn't say that that's great for you. However, is that we know the amount of nicotine that gets into somebody's system and the effects of the chemicals that are, that they're inhaling. You have to be in it for a long period of time, and surrounded by it. So.
You have a question
Thank you. I actually went to, my name is Marjorie, I actually went to one of the nutrition body analysis, I think someone on the panel was there for that. And they talked about increasing your strength in terms of your body health. That made me think, well, isn't it important to build muscle if you have to increase your body strength? So the little debate that the two of you were having, I need more information.
You can have that debate right now, if you'd like.
Okay, get ready.
So perhaps maybe, Kevin, you can clarify the difference between moderate and high intensity and consistently high intensity resistance training versus moderate intensity and the effects of it.
Yes. Strength training in general is very good for health. Just carrying a little extra muscle mass. Muscle actually releases things into the body that can reduce body fat, that can actually cross the blood-brain barrier and have a favorable psychological effect. So increasing strength and increasing muscle mass is very good for health. When it comes to the arteries, it's really very high intensity powerlifting and bodybuilding. There's a very competitive aspect that can be possibly detrimental to the arteries. But for health overall, there's lots of large epidemiologic studies that those that have more strength, that prevents disability with age, that keeps you physically functioning with age, and that also has reduces risk for heart attack and stroke. So muscle mass and strength is very important for overall health.
A lot of your discussion is sort of a global recommendation. Is there any way to quantify an exercise prescription? That was my first question. And my second was to Dr. Myerson, I believe, the physician. When you are adding this information to your EMR and you're giving a prescription to a patient, would you factor in the fact that this person who does exercise maybe gets a lower amount of a particular medicine? And if so, have you had any long-term studies on that, like the Dean Ornish program? I would like to get a little more quantification on this aspect of exercise and how do you go about designing it?
Okay, I think any of us can address the exercise prescription, but in terms of the research, there's a pretty large body of literature comparing. I think Kevin also said that people who walked away from having a stent and had exercise. So, I mentioned in my brief talk that people who are pre-diabetic, I or they do the work, prevent themselves from becoming diabetic. So I see it day to day, I'm in the trenches. But there is a large body of literature and research showing that exercise can reduce the amount of medicines, dosage of medicines, heart events, meaning heart attacks, strokes, things like that. So in terms of the exercise prescription, I think any of us can handle that.
Yeah, actually, I was the author of the 2011 American College of Sports Medicine paper on the exercise prescription for adults. And
There is a wide body of literature, and I think the recommendations that we have that are in the physical activity guidelines come from the body of research. And we know that there's a dose response. And so that's the reason why we are now giving the message, just do something. That if you do a little more in terms of duration, so the target for aerobic activity would be at least 150 minutes per week of moderate activity. So that could just be, going for a walk where your breathing is a little bit elevated, or more vigorous exercise such as running or swimming. And then you can do about 75 minutes per week.
So do we need to reach that target heart rate
No, you don't. That the heart rate and the target heart rate that many of you probably hear about when you go to the gym, and while it's true that a bit more intense exercise does have additional benefits over less intense exercise, what seems to be most important is the total amount of exercise you do rather than how intense it is. So it's really a matter, if you feel more comfortable just going for a comfortable walk, and you can do that for 150 minutes a week, or even less than that, and you do it regularly, that's much more powerful than trying to do something more intense where you feel really short of breath and uncomfortable and unpleasant and stop doing it. So and then the same, with resistance training, we have very, scientific basis on our recommendations, but there's a wide range.
This gym right here.
Thank you. Does the time of day make a difference when you exercise? So no, it doesn't.
What? There's a lot of argument about this, whether you should exercise before you eat or after you eat, and I don't know what my colleagues, how they weigh in on that. I think that, it's not fully clear. I think, we do increase your energy expenditure when you're active, and then, you'll burn calories for a little bit, at a little bit elevated rate for a period of time. But some people find that exercising before they eat reduces their appetite, but not everybody. So I think, again, it's really what works for you. And when it comes down to it, do it. And then, try it out, see what works best for you.
Carol, I think we take one more question.
Yeah, I think we have time, so
Oh, we can.
Any comment on the sport vest? Any comment on the sport vest? We have a friend that's a personal trainer, and he was kind of showing us the sport vest. He was wearing it, and then I tried it on, and I don't really know how. I feel like it's restrained, but I just want to know, any comment from the panel. Thank you.
So I think the difference between, if we're talking about exercise as medicine, and just to try to be really the main thing, I think what Carol was trying to say is that if you're as consistent as possible, then you're going to get the best effects. When it comes to something like using an apparatus like a weighted sport vest, that then turns it into, you now have a goal if you're trying to lose a certain amount of weight or burn a certain number of calories, or you're trying to get your body to look a certain way. So we can go down that road and talk about those specific recommendations. If you have to buy a device, then it probably is not going to get started, right? The answer is, as we just said, being consistent. And so unless that device can really make you consistent, I'm not sure that I would buy it.
So two things came up that I have two quick questions. One was when you said it's the time, not necessarily the intensity. I've always, when I've done weight training or aerobics, always wondered, well, what about all the Tai Chi and stuff that seems almost like not even exerting any energy, yet you see like 97-year-old people doing Tai Chi, and I'm not sure what effect that has. And then the second question is, you were just talking about the thing that keeps you consistent. What do you all think of the Fitbit?
something about Tai Chi. I mean, it's a wonderful exercise, and it actually fits in that one category that I showed that's called neuromuscular functional fitness. You know, it really helps a lot with balance and agility, and one of the things that happens as we get older is that, you know, we start to lose all of those things, and then all of a sudden you're older and you fall over because you don't have balance, you don't have enough muscle mass, and you break your hip, and then things go downhill from there. So, you know, Tai Chi can be wonderful. It also can be, part of the sort of mindfulness practice, which many people really enjoy and find very beneficial. So, again, what you enjoy is the most important. We don't have as much research about things like Tai Chi or Pilates or yoga in terms of its impact on longevity and some of the different biomarkers like cholesterol and glucose and so forth. But we're starting to get that, and I think, if it makes you feel better and you're moving your body, you are getting lots of benefits. I don't know if somebody else wants to talk about the Fitbit. I have some very pointed opinions.
I have seen around the city so many older people with canes or walkers or shuffling around. I have a couple of friends who have had knee replacements in their 60s or a hip replacement. Somebody who didn't break their hip, somebody who was very active, and I saw on PBS very recently that a couple of young men had designed some shoes that would replace hip replacements and knee replacements. Are there any exercises that somebody can do for the knees and for the hips to avoid these things? Or is there dead
The
silence?
answer always comes back to lifting weights.
Strength training is very, very good medicine for bones and
What kind of specific strength training for the knees, and what kind
Squats.
of specific
Squats. Right? If you have a very strong lower body, then you're going to prevent the decline that goes along with that with age.
Yeah, but there must be something for the knees, because there's
Squats.
muscles.
So it's the muscles around the knees that help the joint work properly. But I will also make a comment, because some people think if you exercise a lot, you're going to get arthritis or end up having to have joint replacement. And the studies actually don't support that. People who do a lot of running don't necessarily develop these problems. A lot of times they're associated with injuries that people have had at some point. So exercise might have some negative effects, but generally is good. And by the way, about the Fitbit or any gadget, if it helps you exercise, then fine. But they're not terribly accurate. They sometimes give you misleading results and actually tell you to do less exercise or more exercise than you've actually done. But if that thing helps you get out there and move, then go for it. It certainly can be a very helpful tool for those who enjoy it.
I understand also that as you age, you lose vitamin capacity, and I've understood that vitamin D will help build muscles. Is that true?
Well, there's I think both Joe and I may comment on it. So there's been a lot of debate about vitamin D and its role in overall health, and certainly you need some for bone health, but I think the research in terms of cardiovascular health has not been shown. So I'll let Joe, I don't know if Joe has any research on the muscle.
With vitamin D, no. The thing that helps you build muscle is having protein synthesis and preventing protein breakdown. As simple as that. And so the best way to do that is squats.
We have just time for one
exercise too much. You mentioned before that your arteries will harden, people who are extreme runners. How do you know when you're doing too much? And I have a Fitbit, and it does motivate me to walk my 10,000 steps. However, I'm also a pianist, and it does count my hand movements as a step. Sometimes it'll go to 10,000, you know, going over 10,000, it's a party, it jiggles and stuff. And, it'll do it when I'm playing, so.
I wish I could have put a few more pictures in there for that too much part. These are individuals that are running ultra marathons once a month practically. So these are individuals that are running in extreme environmental conditions for hours upon hours.
So 12,000 steps a day.
Definitely. These are people that are in extreme forms of exercise, but taking it to the point that they think that more of a good thing could be a better thing, and sometimes that's not the case. But in general, with the amount of movement that we can do throughout the day, it will be better.
Great.
One more question.
Yes, I'm interested to know, first of all, can you imagine this entire place next year, everybody standing up and moving? I'm wondering what you think of the walking desks and the constant, that message that's out there, and how much of that? I'm sort of also looking for this answer, which would be when children, as a teacher or as a parent, have a low arousal rate regarding exercise, and you've kind of gone through this and that and this and that, do you have a recommendation or a suggestion or programs you like out there? Is there a place that you really like to get that information? Because I find that, obviously, as you have mentioned, that one size does not fit all. You like what you like, but is there sort of a location of approved programs for children?
Well, first of all, my dream would be to have an active classroom here at TC where the students aren't sitting, that we are using things like treadmill desks and other kinds of things. We do have treadmill desks in our library. We have one available in our labs upstairs for students to use. I think for kids, there are a lot of different choices. We've been doing some work. We have a program called SKIP that we're using, developed for very young children. We have a doctoral student who will be piloting some training for preschool pre-service teachers next year to start teaching teachers about that. But there are a variety. I can't give you one exact place because that's something that's really being developed a lot. But I think classroom teachers do need more tools to keep kids moving around, and schools have really cut back on everything, no recess and no PE.
Well, thank you very much. This has been a wonderful and energetic